My name is Nelly Munyasia. I'm the Executive Director, Reproductive Health Network Kenya, and the 2022 East Africa Leadership Journey Cohort. My project is on women healthcare providers as change agents for sexual reproductive health and rights in Kenya. When I took up this leadership journey, I thought about what change I needed to make after this journey. And I thought about mid-level providers that have not had opportunities to get into leadership, to take up leadership roles in this country and also across the region. So this was an opportunity for me to support mid-level providers into becoming and taking up leadership roles. And then I looked at COVID-19, human crisis, and climate change that continuously overwhelm public health systems. And that is still the areas where a lot of mid-level healthcare providers needed to take up leadership roles and support in strengthening health systems. SRHR also continued to be less prioritized during the pandemic, and we saw a lot of women and girls being affected. And we've continued to see, even in hunger crisis, where we've had floods, women and girls continue to be mostly affected. So during the project, I looked at building the capacity of young women healthcare providers and pairing them up with mentors, senior healthcare experts, to support them towards the journey of them becoming and taking up leadership roles. So I looked at increasing self-awareness among the mid-level healthcare providers that then were going to become SRHR experts that would support in advocating for progressive SRHR policies within Kenya, and then strengthening social accountability, and this is through youth engagement and advocacy, and also just bringing out their role on holding policymakers accountable when it comes to policy making and implementation. During this leadership journey, I was able to tailor-make some of the SRHR advocacy and accountability training materials, and I was able to develop them, of course, with support from the experts in the system. I was able to build the capacity of young mid-level healthcare providers as advocates, and I was able to pair them up with senior healthcare providers who are also mentors that are continuously providing them with mentorship towards them becoming then health SRHR experts. Some of the challenges that I faced include limited financial resources that contributed to me now using the adopting the virtual trainings, where I provided trainings, and of course my role as an executive director is quite demanding. So this contributed to not effectively being available to implement the project because of my other competing tasks. I would say that the WomenLift journey has really impacted me positively. I've become a more authentic leader, committed to bettering myself, and more importantly, prioritizing myself. I'm able to say no and focus on Nelly becoming a better person and becoming a better leader. Entrenching the culture, of course, of self-awareness, assessing my values, likes and dislikes, and being able to authentically speak about them and taking action while getting support. Then in terms of becoming an all-inclusive leader, building relationships and collaboration, and that's something I've also done amongst the cohorts, and creating social connections, becoming a change agent, not only towards my cohort mates and also the people that I work with and people that work directly with me. Becoming a very strategic leader in terms of thinking about the future, thinking about today, tomorrow, and the future, and what I want for myself and the organization that I have the opportunity to lead. Also increased mental resilience. I've become more resilient, more focused and looking at what kind of results I want to get at the end of the day. I'm becoming more impactful by the day, and I've seen this because I'm able to transfer this to the senior managers that I work with, and being able to just mentor them, towards them also becoming the better version of themselves. I'm able to convince and put up a case speech and say, this is why probably I need resources for the organization I work for, and this is why I need need to, and this is the reason why I need to continuously push so that we are able to see more more results, and why even my work is important more to the people I work with, to the donors, to the funders, and even to the partners. So really, this has been a very impactful journey, and I look forward to just taking out what I've been able to get from this leadership journey and becoming a more better, authentic, and resilient leader. Thank you.